A very controversial topic in the medical field is physician-assisted suicide. I know that it might bring painful thoughts or feelings to light, but I think this is a good topic to discuss, especially with all the arguments and debates on it. Why would people decide in their right mind to go down this route? Well, today I'd like to persuade you that physician-assisted suicide is actually a wrong and ethical action. There have been many advancements in the medical field when it comes to palliative care and managing a patient's pain. In an article from Linacre Quarterly, in medical practice today, pain relief is almost always possible given modern therapeutics in analgesia and the medical specialty of pain management. Since pain can be alleviated, there is no basis to assert a need for physician-assisted suicide because of intractable pain. In fact, concern about pain is ranked 6th out of 7 when it comes to different reasons why people are afraid to actually die or choose that option when they're trying to decide if they want to go for physician-assisted suicide. But it also brings up a very unfortunate topic. If unbearable pain is the limit, then who is to actually decide what counts as unbearable pain? Is it mental anguish? Is it actual physical pain? Is it economic distress? At some point, there's a line, and that line can get blurred. Which brings my next point of discussion. Physician-assisted suicide is quite the slippery slope. In the same article from Linacre Quarterly, if physician-assisted suicide is made legal, then other things will follow, with the final end being the legalizing of euthanasia for anyone for any reason or no reason at all. In fact, in 2002, Belgium legalized euthanasia for competent adults and emancipated minors. And in 2014, they then legalized another law that any euthanasia of minors is allowed, especially if it has to do with the medical aspects of that patient. So if a parent feels like their child isn't fit to carry on, like they have cancer, they can just have the doctor administer enough meds where they'll pass away. And asking a physician to perform this physician-assisted suicide undermines the principles and ethics that they swore to uphold when they became a doctor. Not only that, it would undermine the trust between a patient. The elderly in Netherlands had begun to carry a sort of card with them, so if they were ever admitted to a doctor's office or hospital, it would read, I do not allow any euthanasia to be performed on me, like in the case where they might be in a coma. In conclusion, I want you to think more about this subject and how those most affected by physician-assisted suicide may feel. If even the elderly are afraid of going to the doctors, and they're losing the trust of seeing a physician if anything should go wrong, it's an unfortunate set of options when you can't even go to a doctor because you're afraid that you're going to end up being killed by a doctor. So I think it should be time for us to stand up to the right to live and not be afraid. Thank you.